Dr. Keith Darrow, I am so excited to have this guy on with us. He's an incredible speaker and incredibly eloquent about what he does. And I love his passion, and I share that same passion for doctors. And I'm happy to report he does too. So let's jump into this next interview with my guest, Dr. Darrow.
When we think of hearing loss, we think of it as a nuisance, something that happens as we get older. Yet the science is telling us that living with untreated hearing loss, it changes the brain, and not for the better. And it can significantly increase the risk of cognitive decline. And I guess for me, it's over the years it's become personal because 4 in 10 cases of dementia are considered preventable. And until we really get that word out, see, right now, the diagnosis of dementia, it's permanent, right? We all know somebody who's survived cancer. You don't survive dementia. Yet,
Nothing in this podcast is intended to render legal, financial, medical, or other professional information. Because the details of your situation are fact-dependent, we highly encourage you to find a recommended individual that you can trust to give you the expertise that you need related to your situation. Well, good morning or good evening, DocPreneur Nation. You're listening to Concierge Medicine Today's DocPreneur Leadership Podcast. I'm excited about our next guest and our topic today. We're going to talk about how to treat better, kind of best practices related to hearing loss and tinnitus with Dr. Keith Darrow. He's the co-founder of, I want to get this right, Excellence in Audiology, and you can go to excellenceinaudiology.org. But he's an audiologist, a neuroscientist, a distinguished expert. Everybody, all the guests are better at telling their stories than I am. So, Dr. Darrow, thank you for being with us today.
no, thank you for having me. And yeah, happy to share my story. What started out as basically a passion to help people. I know that sounds pretty generic, but I found my path when it came to hearing loss. I was studying it at the undergrad level. I became a clinical audiologist at the graduate level, and then said, you know what? I still don't feel like I know enough. So I pushed pause on my clinical practice and went back to school, a joint program at MIT and Harvard Medical School. I worked in the labs at Harvard Medical School for nearly 12 years, have a PhD in neuroscience, and then decided to come back and really try to bring together the clinical aspects of treating hearing loss and tinnitus and the scientific aspects, because there's so much that we don't know, be it a patient, be it a physician, right? And to me, it's just this fundamental concept of when we think of hearing loss, we think of it as a nuisance, something that happens as we get older. Yet the science is telling us that living with untreated hearing loss, it changes the brain, and not for the better. And it can significantly increase the risk of cognitive decline. And so thank you for having me on here today to sort of tell my story and help to advocate for, in our country, in America, there's 73 million people living with hearing loss and tinnitus. Worldwide, we're at 1.5 billion, estimated to reach 2.5 billion in the next 20 years.
Wow. Well, I know I don't know, and I'm not a physician, but I am a patient, and I know my listeners are probably like, he says that every single time. It's so annoying. But if you're a first timer or whatever, as a patient, we feel unresourced. Like, where are we going to go? And probably the first person we're going to talk to is maybe our primary care doctor, or we're going to ask a friend who just recently maybe has an, nursing background, whoever we bump into, we're going to be like, so where do I go and get hearing help?
And that's just it, right? So here's to me, this is like the biggest conundrum in healthcare. Hearing loss, tinnitus, they're the number one, not number 2, not number 10, not somewhere in the top 100. It's the number one most common neurologic condition on the planet. Yet Yet it's also one of, if not the least treated neurologic conditions on the planet. And to me, that gap has everything to do with education and advocacy. And when I say education, I'm not just talking about you, the patient, the layperson. I'm talking about even within the medical fields. What's great is in peer reviewed literature, when you look at, say, the Lancet or Science or JAMA, right? I'm talking about the big medical scientific journals. In the last 5 to 10 years, there's really been this big uptick in peer-reviewed science when it comes to hearing loss. Unfortunately, I think, as that science emerges, there's a delay to when it starts to become, let's call it a household conversation, or when you turn to somebody, be it a nurse, a CNA, a social worker, a physician, and say, hey, I'm worried about my hearing. What do I do? Right? Because right now you ask that question, I shudder to think what the answer would be. Um,
Mhm.
dare I say, go get a hearing aid, because, going and buying a hearing aid, getting a hearing aid off a shelf never helped anybody. Whereas
Mhm.
there's incredibly effective treatments out there.
I remember my wife was struggling with some hearing, and she's like, I don't know if I have a problem or not, and I have no idea where to go, what to do. My doctor doesn't even know my name, and I've been with her for 20 years, and so she's like, I don't know. I was like, well, yeah, I don't know. I can ask some folks, and see what they recommend, and then she started going down the rabbit trail of the internet,
Uh-oh.
which is always good, right? And then stumbled on like to Apple AirPods and all these other direct to consumer items that you can purchase direct off the shelf, and that's probably not the trajectory she needs to go anyhow. But it
No. And
quickly
that's,
got
look,
forgotten.
so, and that's exactly why we started excellenceinaudiology.org, because of the lack of education. Yes, you can
Mhm.
go on there and you can find a local hearing and tinnitus specialist. That's great. But before you get there, the one thing that people want is education and information. Look, I never, ever grew up saying that I wanted to write a book. When I was asked to write a book, I said no the first, second, all the way through like the 15th time. But finally, I think somebody knew how to pull at my heartstrings, and they said, look, this book will never be about you. Writing a book will be about your opportunity to educate the 73 million adults living in the United States with untreated hearing loss. And because you can't treat all of them, there's no way you could influence enough people to even try to treat them. How about just getting out the information? And sure enough, I think that's why several of my books have become Amazon.com bestsellers, not because I'm a good writer, because I'm not, but because people are yearning for information on what do I do next. So that's why we've put together that resource. And then if you feel motivated, it's right for you, and you want to find a provider, great, go ahead. I think that's a good thing, but that was never the intent for this movement.
So tell me a little bit about Excellence in Audiology, the organizations that you work with, how, being that this is a physician geared podcast with general information,
Great.
how do they connect? Why should they connect? This is the part of the question where I ask multiple questions and then ask you to just riff on them. But the
Yeah.
other thing is, maybe what are the top three things that are not being asked by primary care doctors that you're like, "Oh, I just wish they would ask better questions." So riff on those couple of
Okay.
things
Okay.
related to
I don't even know
physicians.
where to start, but how about I start here? I'm gonna go with your last question, because that's the one that's closest to mind right now, which is, what would I tell a doctor to ask a patient? The problem with asking a patient about hearing is you really don't know what you got until it's gone. And the thing about hearing, or let's say hearing loss, is yes, there is something called sudden onset hearing loss, but that's a tiny sliver of the population. For the rest of us, it's something that happens as we get older. And it's something that happens so gradually that us as human beings tend to say it's not me. It's the restaurant that's too loud. I can't
Hmm.
hear. It's my grandkids who mumble. It's my wife's fault for talking to me from the other room. There's never that introspection. So if you ask somebody, and by the way, I'm saying don't do this, because if you ask somebody, how's your hearing? It's fine. I guess it's fine. Right. When somebody says my hearing's bad, I can promise you then it's really, really bad.
Hmm.
And those are probably the people that have already acknowledged a problem. They've already been tested. They've already, started treatment. It's the people, it's the silent epidemic that most people, the hearing loss process starts in the 50s. So I guess it's not a question, it's a recommendation. If you're 50 or older, you are very likely to have some hearing loss. What stage is it at? How bad is it at? We don't know until you have a thorough, diagnostic evaluation. And so for me, our push has been don't ask the patient about their hearing, ask them what their age is. And if they're over 50, then they need to be recommended to have a thorough evaluation, not a hearing screening, because hearing screening won't catch that early stage. So that would be my first thing. I guess the one question I would ask is, do you, to the patient, do you experience any ringing or sounds in your ears? So like when you lay down at night and it's really quiet, or you get up in the middle of the night, go to the bathroom, or, it's just you're in a quiet environment. Do you hear any sounds in the background? Because essentially that's your check engine light, right? That's your brain's way of saying there is a problem and you need to do something about it. And like most of the time with the check engine light, you can keep driving. The car will get you to where you want to go, but something's not right and you need to get it checked. So are you over the age of 50? Let's go get a full evaluation. Best case, there's nothing wrong. Even better case, there is something wrong and we catch it early to effectively treat it. And then I would ask if you have any ringing in your ears. And if so, that is a definite red flag. Now, back to your point, what information would I like to get out there? To any physician who's listening, maybe you've read the papers. This has been in the Lancet. This has been in JAMA. This has been in the Alzheimer's and Dementia Journal. I have three simple messages. If you or your patient has difficulty hearing, like, hearing soft things, that is linked to an increased risk of cognitive decline and dementia. Number two, if you or your patient has difficulty listening, meaning do they have difficulty following a conversation when there's background noise? So anything that's competing, if that gets in the way and interrupts listening, that has been linked to an increased risk of cognitive decline and dementia. And third, if you or your patient are experiencing tinnitus, ringing sounds in the ears or in the head, that has been shown to be significantly linked to an increased risk of cognitive decline and dementia. And so all you got to do, I guess maybe those are the three questions. Any difficulty hearing, listening, any ringing in the ears. But that's the information that has to get out there. Hearing loss is not just a nuisance. It has the potential to impact emotional, social, physical, economic, and cognitive health.
What is the difference between a full evaluation of your hearing versus a simple hearing test?
So so I think there's three levels, right? So a screening is just, do you hear a couple of soft beeps? Raise your hand when you hear these soft beeps, and they play like three of them. And typically they actually play them loud enough that most people will hear it, and it won't catch early stage hearing loss. It won't even catch early to mid stage hearing loss. So screenings, and I'm not just saying me, this isn't like just me personally. There are a lot of voices in the hearing healthcare community saying we need to completely get rid of screenings until we figure out or find a screening tool that will catch even the earliest, right? It's not a good screening tool if it misses 60% of people. I think you would agree with that. So then there's a simple hearing test, which typically involves, right? You listen to a few more beeps, raise your hand when you hear them. They're low, mid, and high pitch. Um, Repeat back some words in a nice, quiet environment, like say the word ball, say the word tree. And then there's, they usually run a test to see how the eardrum's working. That's your basic hearing test. All excellence in audiology.org providers. We have a 7-step cognitive screening and diagnostic evaluation. So let's start with the cognitive screening. Because hearing loss is linked to a 200 to 500% increased risk of dementia, very first thing we're going to do is a cognitive screening because we want to know if you're at risk. Look, if you're in my office, you have hearing loss. We can kind of assume that. So we're going to run that cognitive screening. Then we're going to do a full outer ear assessment, understand how your ear canals are working, how your pinnas are working. Then we're going to see how your eardrum is moving, a thorough middle ear assessment. Then we're going to go into the inner ear where those little cells are that dance around when sound comes in. We're going to measure those. Then we'll do some beeps. Then we'll do some words because we want to understand how is hearing loss impacting clarity, right? Nobody comes in and says, I can't hear beeps. They come in and they say, I'm missing bits and pieces. I know that you said something. I'm just missing some of the details. Well, we call that clarity. So we do a thorough clarity assessment. The number one complaint of people with hearing loss is they can't hear in background noise. Yet less than 15% of hearing healthcare providers actually measure the ability for your brain to process in background noise. Well, we do that, right? So there's a number of different parts that are missing with your regular or simple hearing test. We kind of leave no stone unturned.
Wow. Well, I want to ask 3 targeted questions
Okay, let's do it.
for kind of all the different age groups. So we're going to hit the younger ones and first, and I think that it's a 2-part question. Technology, the future of technology, the field of auditory functionality. Where is that going? What are you excited about? How far have we come?
Oh,
I'll let you tackle that.
So how far have we come? Look, say the word hearing aid, and I promise you 95% of your audience in their mind is picturing what we call the beige bananas, right? Those big beige bananas that sit behind the ear with a big clunky mold that goes in the ear. I wish I could say those days are gone. And for the most part, in advanced treatment centers, like we don't really use those anymore, but you can still buy them almost anywhere.
Yeah.
I would say historically, most hearing aids, and I'm going to lump them all into one category for now. I'll come back to that. Hearing aids have just been amplifiers, right? And so they just made things louder. That technology at this point is like pretty ancient, although turn on TV midday, go to a big box store, go to Amazon, you can still buy them. Okay. So that's one level of technology. Then there's, actually, this is a new category that was created by the government, which is the over-the-counter hearing aid. Task force started in 2017, sometime last year, finally went into effect. Now there's a new category of over-the-counter hearing aids. The problem here is over-the-counter healthcare, in which, right, there's been lots of studies on this, compromised care, compromised patient outcomes, and there's never been a shred of evidence-based data that says, go buy a widget, go buy an over-the-counter DIY hearing aid, and, hear better, reduce your risk of fall, reduce your risk of cognitive decline, reduce your tinnitus. Never been shown. And so that's kind of the wild, wild west. Then the government also said, in addition to this category, on top, there's prescription medical grade hearing aid technology that has, talk about advances, basically artificial intelligence. that has a little bit of a mind of its own. Don't get too scared, but it is basically trying to make decisions for you. What I mean is your brain can't separate what you want to hear from what you don't want to hear. Well, new technology can do that for you. It knows when to enhance clarity. It knows when you're watching TV. It knows when you're at a noisy restaurant. Some of the new technology has even more advanced features, whether it be, right, fall detection. I think that's a big one because people with hearing loss are more prone to falls, traumatic falls. And so there's actually technology wherein not only will it detect a fall, but somehow, I'm not a tech guy, but somehow it'll send your next of kin, it'll send your loved one a text that says, hey, mom just fell, right?
Mhm.
And I believe it could even
Wow.
alert like the authorities. So there really are some pretty impressive um, leaps and bounds when it comes to technology. And while I still put that in the cool category, probably the number one compliment from a patient, and this is new because of the new technology, is I feel like I hear naturally again. I
Mm.
feel like I hear what I did when I was 20, right? And you know, we're not curing hearing loss, but that's how good the technology's got, which is why we have a 97, 98% patient satisfaction, right? That has come not only with advances in technology, but with advances in clinician knowledge about the science of hearing loss and how to treat it better.
Wow.
Did I answer
So
your two
you had
questions?
no, yeah, and then you got
Okay,
into it, on the fall the results of how hearing loss can result in fall injuries. That was going to be one of my other questions. And you've kind of touched on a little bit, how can a trip to an audiologist reduce your risk of dementia, being that so many concierge medicine physicians do have an older clientele,
yeah,
usually over the age of 50.
yep,
Uh, it seems like we're getting dementia earlier and earlier. At least we're hearing about it maybe more and more. Maybe that's why it feels like to a patient that mom has it, and she's. 63.
yeah, yeah,
So, talk a little bit about how dementia and maybe some of the evidence and data, that literature that you're bobbing
sure.
in and out of, what it's informing you of that doctors may or may not be aware of yet.
Look, I think we have to face the facts, which is right now, if we do nothing, dementia rates are expected to triple in the next 25 years. I think one of the valuable lessons of COVID is our current healthcare model is not capable of a significant influx of sick older adults, right? So there's that fact. I think match that up with the other fact, which is, and everybody listening knows this, the number one fear of an older adult, it's not cancer, it's not a heart attack, sure as heck ain't hearing loss. The number one fear is the loss of independence. That's where treating hearing loss and tinnitus comes in. Our goal is to help our patients remain active, to be confident in who they are and how they hear and they're part of society, but to also help them to remain passionately independent, because treating hearing loss has been shown to reduce the risk of a traumatic fall. You and I and everybody listening knows a traumatic fall for an older adult, it's devastating, and it absolutely leads to a loss of independence.
Mhm.
Cognitive decline. What do we know? So two great studies, one out of Johns Hopkins, one out of Australia, and they both did the same thing, which was, okay, let's take a group of people, older adults, who seem to have some cognitive impairment, not diagnosed with dementia. We'll call it maybe mild cognitive impairment. Even that wasn't always labeled. It was just there was a decrease in cognition, decrease in memory. They treated their hearing loss for 3 years. These are the two most longitudinal studies out there. What they found in this group of people is that they were able to slow the progression of their decline, right? Compare that to a group who did nothing, who basically went down the tubes significantly over a 3-year time span, whereas the group that were treating their hearing loss preserved their cognitive performance. Now,
Mm.
this is really important because if you can, like, this number is staggering every time I say it. If you can reduce the conversion, the number of people who convert from mild cognitive impairment to dementia, if you can reduce that number by 1 year, if you could push off the conversion 1 year, it's expected globally there'll be a 10% decrease in rates of dementia.
Wow.
Now, I don't have the data, but imagine if you could slow decline by 3 years, what that would do to the worldwide rates of dementia. I think it would be staggering. And right
Yeah.
now, the only thing available with not a single side effect is treating hearing loss that is that powerful.
Wow. You know, I want to take a turn for a moment because
Mhm.
I think that I mean, I didn't grow up in high school, left my high school graduating class and thought, I'm gonna go help, organize a medical conference or work with concierge doctors. Like nobody has
Sure.
that direction in life, that specific direction. So I'm curious, what drew your interest and passion for this? Because I hear your passion coming through so wonderfully related to this topic. So much so that I probably have never met another physician. I've met hundreds of them over the years that is quite as passionate about the topics that we're talking about today. So what really drew your interest in this? Was it family business, or was it just a story from a loved one or a friend?
No, look, I'm part of that first generation, right? Parents didn't go to college. Um, but I am definitely, you've all heard that expression. If you love what you do, you never work a day in your life. And I absolutely unequivocally love what I do. And I feel like more than being a hearing healthcare provider, more than being a neuroscientist, I'm trying to be a voice for the 73 million, the 1.5 billion worldwide. Y- Sure, of course, like every family, I too have been touched by cognitive decline and dementia. I lost my grandmother to dementia. I currently have an aunt in New York with Alzheimer's. I have another close family member who's an older gentleman with vascular dementia. And I guess for me, it's over the years, it's become personal because 4 in 10 cases of dementia are considered preventable.
Mm,
And until
that's
we
good.
really get that word out, see, right now, the diagnosis of dementia, it it's permanent, right? We all know somebody who survived cancer. You don't survive dementia. Yet 4 in 10 cases are considered preventable. This data is out from 2020, published in the Lancet. The Dementia Commission, I kind of refer to it as like the Bible when it comes to dementia studies. I refer to it as the go-to, the landmark study. That's mind blowing, right? To think that 4 in 10 cases could be prevented. Now, the question is, how do you prevent it? And this task force, excuse me, actually put forth 12 recommendations, and they put them in order of importance. And what drives me nuts, and I won't play the game with you, but I ask people all the time, hey, what do you think is on the list? And everybody says sleep. It's not on the list of the 12 things. They say eat better, diet, exercise, diabetes, stop smoking. Yeah. Okay. You're getting closer. These are on the list. But the number one modifiable factor, again, not number two, not number 10, not number 12, number one modifiable factor for preventing cognitive decline and dementia is treating hearing loss. And that is mind blowing to people, right? Because up until that very moment, you might have thought everything this guy's saying is like opinion, it's bias. He's been working in the field. No, this isn't my report. This came from over 50 of the smartest researchers and clinicians on the globe that said treating hearing loss is the number one modifiable lifestyle factor to prevent cognitive decline and dementia.
Wow. So if a physician's listening and they're like, I get it. I'm in. I I understand. I need to ask better questions. I need to ask more questions.
Yeah.
I need to understand the three different tests. How do I get connected as a physician listening to you, to what you're doing? Because I want to learn more. I want to stay connected. I want to be
Yeah.
resourced appropriately.
Look, the easiest way is to go to excellenceinaudiology.org, right? That's where you'll find lots of information about our mission, about our vision, about our local providers that might be in your backyard. If you know, right? Look, if you're looking for more great hearing healthcare providers to refer to, we'd be happy to take recommendations. Keith at excellenceinaudiology.org is how you reach me. That's pretty easy, but there's also a contact us right on the website. But that's a great place to start. I've written books. So if you're interested in educating yourself or patients about tinnitus, just published a book in the last couple of months called Silenced. You can get a free copy at stoptheringingtoday.com. I think they just charge a few bucks for shipping, but I'm not looking to make money on books. I just want to help more people.
Well,
Preventing
I've written a
decline.
lot of books, and I'll tell you from experience that you don't make a lot of money on books.
Exactly. It's not about that, right? You said back
Right.
there, right? I think one of my personal favorites, Preventing Decline, everything you need to know about the medical treatment of hearing loss and tinnitus. That's on Amazon. That became a number one new release, a bestseller when it first came out. So, you can get that there. But, the more education we all have, the more connections we have, the more people we can help. So that's why I wanted to be here. And that's why, I just want to say thank you for doing this podcast, for helping advocate for not just the patients, but for the physicians on how we can, better communicate with each other.
Well, I mean, I never went to medical school. That's probably glaringly obvious to folks, but I have learned as a patient here, and as a sandwich generation caregiver to, three young kids and my aging parents who, I never considered this. And so even if you're a general information person listening and you don't have medical background, I mean, these are great questions. This is great information that you're providing. Excellenceinaudiology.org. We'll put the links in the show notes as well as to the books, as well as the contact information of Dr. Darrow. And there's just so much here. You made the tie very nicely between mental health and dementia and cognitive decline. I mean, hearing impacts much more than I realized. And for those who have medical backgrounds, you probably, well, duh, I already knew that, but hopefully you didn't know that, and you'll be able to be resourced with excellenceinaudiology.org. So now we move into the lightning round of questions. You can be however brief or long-winded as you would like
Okay.
to.
All right, let's do it.
So I think that you've kind of touched on it, but I like one of these topics here: turning up the volume on prevention strategies, preserving hearing health. Talk to everybody out there. Maybe what's the top three items that you wish your folks would do?
Look, I think you have to think of it in terms of primary prevention and secondary prevention. What I mean by primary is, yes, as you grow up, if you have family members that are younger, one of the most important things is, how do I prevent compounding my age-related hearing loss? And the number one way to do that is to just turn down the volume, right? So I'm also all for advocacy when it comes to noise exposure, wearing earplugs at concerts, and we put that in the category of primary prevention, but ultimately it's all about your genes. And age-related hearing loss is written in the mammalian genetic code. So whether you're a mouse or man, You will get hearing loss as you get older, which brings me to secondary prevention. Secondary prevention in medicine is all about, okay, you have the problem. How do we make sure it doesn't get worse? Well, we know that treating hearing loss, treating tinnitus slows down the neurologic decay, slows down the progression of the disorder. Because without treatment, like the snowball rolling down the hill, it's just going to get bigger and it's going to get faster and it's going to get more and more devastating. So you've got to treat it with treatment, right? Because you're trying to now prevent cognitive decline. You're trying to prevent a fall. You're trying to prevent depression and an erosion of quality of life. So this is supposed to be rapid, so I'll stop there.
Sure. You know, I want to hit the pause on the questions for a moment, and I'm curious. The typical primary care family medicine doctor is going to ask a patient a few questions, but then they're going to say, okay, well, you need to do a screening or a test or a full evaluation. The first thing that a patient's going to do is look at their insurance carrier.
Mm.
Um, how do you find the best, or not? I mean, best is relative, but how do you find the right place to go because we're left as patients, we're left to the wolves out here. We don't know where
Look,
to go.
yeah, I think that's a great question, and why we put together the excellenceinaudiology.org community, because right now I might get yelled at for this by somebody, but I'm gonna pull back the curtain when it comes to insurance and hearing. Yes, insurance will cover a hearing test. When you look to the advice, when you look to Medicare, which is what, older adults in the United States have, they will pay $33 for a hearing test. Well, that means right now you got to think about that. $33, it takes about an hour or less, because what providers start doing is they start compromising. Well, hey, if I'm only getting paid $33, I certainly can't spend more than, 30 minutes with this person. Can't keep lights on, can't pay salaries, can't pay phone bills, can't pay, all these things. And so ultimately, you see a lot of cutting corners. We'll call it the simple hearing test that you referred to before. What we've done is, in the excellenceinaudiology.org communities, we have committed to not only best practices, but the 7-step cognitive screening and diagnostic evaluation. And so, beyond Medicare, there are some insurance companies that will pay a significant sum. I always tell people, check with your insurance, check with your local providers. In terms of that, the community is not uniform. Some do accept insurance. Some say, no, it's not worth it. It's not worth their time. So, that's the diversity in healthcare you see out there.
Well,
I
that
think the
that helps a
biggest
lot.
issue, just to help, the biggest issue though, is that when it comes to treating hearing loss, insurance wants nothing to do with it. So most people, it does become an out-of-pocket expense. And so we've fought really hard. Another thing within our community is we've created these affordable treatment plans that will increase access for more and more people to treat their hearing loss.
Oh. Well, thank you for what you're doing and for what the community is doing, because you represent others as well who feel the same passion as you do.
Sure.
And you know, we say around here a lot, it's no longer about being the best doctor or neuroscientist or whatever your specialty may be. It's no longer about being the best doctor in the world anymore. It's about being the best doctor for the world and for your patients and for your local community. And I hope that what we've learned today is that hearing is so important. It's tied to so many things.
Yeah.
I'm curious, when you speak to teenagers and young folks, and you see, is there a tie or a link between, maybe there's been some studies on this, between, vertigo, screen time with the teenagers these days, screen time with adults, aging populations, and hearing? I mean, it's not that your device is too loud, it's that, and this might have more on the ophthalmology side, but, what are you when you see somebody sitting on a screen the whole time, do you ever make a link, or is there evidence out there that's talking about, I'm not trying to make a, do you understand where I'm going
I
on
do,
this?
I do, and I'll just say this: I do focus mostly on older adults. So I'm a little hesitant to speak about the teenage years. And the reason, to your point, yes, AirPods are too loud. And I will just say this, the general rule of thumb is you never go above 75% on any set of headphones. That's when you enter into the dangerous zone. So
Yeah.
that's my advice for the younger generation. But the older generation, let me tell you what popped into my head, and hopefully it answers your question. Because hearing loss is so isolating, because hearing loss is linked to um, deficits in emotional health, decreased physical activity, increased stress and anxiety, what we are finding is that people with hearing loss untreated there is a significant increase in screen time because they're sort of isolating themselves from actually having to speak to people, actually having to interact. And so that is how depression, isolation is manifesting itself now, which is different than 10 years ago, right? Even 5 years ago, right? The population of older adults, or I should say the percentage that had smartphones, was still pretty low. Nowadays, right? I mean, 9 year olds, 90-year-olds, everybody's got some form of a screen, at least most people. And so we do see that a lot.
Yeah. Wow. No, that's perfect. And that's, I think of my mom and think of the amount of time that, she's doing this, and it is, it is concerning for those and all of us that, anyway, excellence in audiology.org. Dr. Keith Darrow has been our guest today. Final, two questions for you. The last book you read, or the one that's sitting on your nightstand right now, or maybe on your Kindle?
I'm still a physical reader. Gosh, I wish I knew the name of it, but I just started reading a book on epigenetics.
Hey,
Um,
yeah.
have you had people on here talk about that? Right. I think
Yes, it has
that
been a
is,
topic.
yeah, epigenetics is definitely something that fascinates me. And for those of you out there who don't know what that means, it's basically, yes, we have our DNA, but at the end of the day, DNA is more about being, predisposed as compared to DNA is not a promissory note. It's not a guarantee. And whether it be the lifestyle, the way we eat, the way we sleep, our education, there are so many things that interact with our DNA that sort of set the course for our future. I think to me, it's just this new realm of we actually are in control of our genetics, at least to some extent. Whereas 10,
Yeah,
15 years ago, it was just, well, your DNA is what it is. There's nothing you can do. And that's just not
yeah,
true. And I think 10 years ago, we thought if you're going to get dementia, it's unavoidable. There's nothing you can
yeah.
do about it. Um, Now we know 4 in 10 cases are considered preventable because it is in your hands to some extent. So I don't know the name. I apologize though.
No, that's okay. That's okay. I appreciate it. That always draws an interest. So, all right, our final question. If you were to hang up the keys, turn them into the next, founder who's going to take over your role, and you got big shoes to that person has big shoes to fill, but you're like, you know what? I did it. Like, I ran the race. I accomplished the mission of what I initially started out to do. What's one story, I'm sure of many, that comes to mind that you're like, this is why I do this?
For me, I mean, my goal here, while a lot of it has to do with advocacy for the patient, one of the things, and this is I think much harder than advocating for patients, which is trying to change the mindset of other hearing healthcare providers and other medical professionals. And in just 3 years, maybe 2.5, we just certified our 900th hearing healthcare provider as a certified dementia practitioner. And that
Wow.
to me is just one of those ways that we're changing the hearts and minds of people in this field. And we've had nurses, social workers, geriatric specialists, and lots of hearing healthcare providers. And so that for me has been a big thing that I feel like I've worked on, we've been successful at, and just getting out there the message that we're really about improving quality of life, improving cognition, reducing, the risk of these other fatal diseases. And so I would just want that message to continue with whoever's next. But I'm not done yet though.
Well, that is a big, lofty goal, and that is amazing. Over 900. So, our guest today has been Dr. Keith Darrow. He's with excellence in audiology.org. I hope everyone today has learned the importance of hearing, the importance of asking questions, been now resourced with excellence in audiology.org. They're not sponsoring this. We're not, they're not paying to be here. We're not paying them, but we feel as though this is education and information for doctors that's necessary that can really help your patients change their communities, change their lives. I mean, you've tied in so many things today, and we want to thank you that you're truly doing great work as well as your community is. You're truly showing and providing a living example that it is no longer about being the best doctor in the world. It's about being the best doctor for the world and for your patients
I
and
love that.
for your local community. So thank you, Dr. Darrow, for being our guest today.
Thank you. And I look forward to continued collaboration. Have an amazing day.
Absolutely. Thank you.